Welcome to another edition of Focus on DeSoto Today. I'm Kathy Jones, Public Information Officer for City of DeSoto. And I'll be your host today as we discuss fighting the spread of mosquito-borne illnesses. We have a very distinguished panel of guests today, and I'm very excited to introduce Zachary Thompson, who's the Director of the Dallas County Health and Human Services Department.
Thank you.
Welcome, Zachary. We also have the Medical Director at Dallas County and the Health Authority, and you are Dr. Christopher Perkins.
Yes.
Very nice to meet you, sir.
Glad to be here.
And then we also have, last but not least, our very own Jimmy Stevens, who's our environmental health specialist for City of DeSoto.
Glad to be here.
Glad you all are here. Thank you so much. With the issue of mosquito-borne illnesses that's been in the news for several years now, first with West Nile virus, and now we're seeing the rise of the Zika virus. Could you explain this situation, Director, with Zika virus as it relates to DeSoto, especially?
Well, first of all, I want to thank the City of DeSoto, your mayor, City Council. We work closely with the Independent School District on an ongoing basis. And so right now we're in the summer and we're faced with mosquito activities. And of course, West Nile virus is still going to be public enemy number one.
Absolutely.
So I don't want us to lose sight of that. Zika virus, of course, is a global pandemic issue. And we've not had a localized transmission from mosquito to humans in Dallas County as of yet. The key point is we want DeSoto residents as well as Dallas County residents to understand is that we have been battling the Culex mosquito, which carries the West Nile virus. We have the Aedes species in Dallas County, and that is the Egypti mosquito that carries the Zika virus. But all of the cases that have been confirmed to date in Dallas County have been imported. We're encouraging the City of DeSoto residents to make sure that they protect themselves. So the difference that we have to look at is that we're talking about a nighttime mosquito or dusk to dawn with the Culex mosquito, and now we're talking about the Egypti or the Aedes species, which is a daytime mosquito. And so the strategies are going to be different as it relates to addressing those two vectors. One, the citizens are used to broadcast spraying that we go around in trucks. In this scenario, under Zika, it will deal with going house to house to look at whether or not there's a confirmed case and mitigating that at the individual's home and surrounding homes.
So if we have confirmed cases, Dr. Perkins, what are we looking for as far as victims of Zika virus? I guess that's how we're going to try to isolate the issue.
Well, let me give you an update, clinically speaking, as far as Zika in Dallas County. As far as the City of DeSoto, there's been one resident of DeSoto that had recent travel history at the time to the tropics and acquired the Zika infection that was confirmed back on March 1st of this year. As far as the county at large, we have 7 confirmed cases. Most recently, one resides in a suburban region up to the north of our county, and that person was a pregnant female. Fortunately, at this time, all the individuals that acquired the infection have recovered. Zika generally has a mild presentation of signs and symptoms kind of similar to the flu, such as a headache, a rash, conjunctivitis, which is also known as red eye, joint pains, also maybe a little stomach upset. Usually lasts about a week as far as the actual symptoms. In regards to recovery, most people recover, and very seldom do we hear anybody have sustained or prolonged symptoms because of the illness. The major complications associated with Zika that's made worldwide news is that it can be result in birth defects in unborn children if the pregnant mothers at the time acquire the infection. Another complication of Zika is that it can result in what we call Guillain-Barré syndrome. It's where the immune system gets revved up and it attacks the person's nervous system, and they can get like we call flaccid paralysis or severe weakness. But by far and large, when we talk about Zika, we also want to be mindful of the fact that chikungunya and dengue is circulating in the tropics. So when people return back to paradise, Dallas County, and if they become symptomatic and they seek care at their doctor's offices, those doctors will also evaluate them for chikungunya, Zika, as well as dengue.
Thank you, Dr. Perkins. I appreciate it. And I think we've kind of covered this, but apparently the difference between the way we're going to treat West Nile with the spraying And Zika is more public education?
Right. I think that's going to probably be the biggest challenge is that, as Jimmy knows, and what we've done over the years since 2002 in terms of the first West Nile human cases, as well as the mosquito confirmed traps in Dallas County, we've been doing ground spraying, and of course, aerial spraying was done. With the Zika virus, we have to really personalize this in terms of strategically going to the confirmed case or index case home, looking at whether or not there are any situations that are creating the breeding opportunity. And with a localized case, we have to mitigate that. We have to look for the mosquitoes in that area in around 150 yards. And so we're dealing with a different scenario with the West Nile virus in terms of broadcast spraying, truck spraying, to now we're talking about on Zika, we would have to go to the home. You may have to have backpack sprayers, go in, eliminate standing water. And so we always have to be frank with our residents, and that's what has been done here in the city of DeSoto and throughout Dallas County. If you're seeing mosquitoes around your home, we're asking you to actually go out and evaluate around your home to eliminate the breeding of the mosquitoes. We go into areas and we look for the breeding opportunities, and what we find is that the breeding is right there in your home, and that's outside. Bottle caps, removing trash, make sure you don't have standing water, flower pots that don't have flowers in them, but they have standing water. So what we're seeing is that people will say, well, what is the city of DeSoto doing? What is Dallas County doing? Well, really the question is, if you're seeing abundance of mosquitoes, then we ask you to do an assessment around your home to determine are there mosquito breeding opportunities, eliminate that, use mosquito repellent, and really you're going to help us reduce the abundance of mosquitoes in Dallas County and specifically in the city of DeSoto.
Yes, very good information. Jimmy, talk to us a little bit about the city's philosophy with the spraying and how we work with Dallas County.
Well, first of all, I'd like to say we have a wonderful working relationship with Dallas County. We defer to the experts. They have a wonderful crew, a wonderful staff of people who provides all kinds of services related to this. And so we work together and we try to provide the best services for the citizens that provides them the most safety regarding these diseases. So we are open and willing to listen to any recommendations that are made. We evaluate those and proceed. So we're team players.
Yeah, and I have a special question for you. I work with Jimmy very closely to help get the word out when spraying is going to occur,
Right.
and monitoring Facebook and get the questions. Please tell our viewers the safety of the spraying. We have a lot of people that are very concerned that it might affect immunosuppressed folks or people with allergies. Can you speak to that? Maybe Dr. Perkins, that would be a good question for you.
In regards to the fact with the adult-decided activity from the spray trucks, we always caution people to avoid direct contact, so to remain indoors during the time
Absolutely.
that
And we do
the
too.
spraying is occurring. In regards to, let's go back to the aerial spraying event back in 2012. We did not see any significant increases as far as people with complications related to allergies, respiratory conditions, even heart problems associated with the aerial spraying. Because, again, the concentration is so minimal that it's only addressing the mosquito, where we're much larger, so it takes us have a larger dose to cause some type of problem associated if we get the vapor in directly. So main thing is to take the precaution that you all are advising, as well as what we're telling people, that when a spray event occurs, that you remain indoors and
Bring your
let it
pets
pass
in.
on. Yes.
And they have the option to opt out in that scenario. So if they can also contact the city of DeSoto or contact, definitely let you know if they'd like to be, avoid spraying when they get to their house. But again, we really got to be frank. If we eliminate the breeding opportunity around our homes, we really are knocking down the mosquito population, and therefore spraying would not be necessary.
Right.
But the fact that as we travel throughout our neighborhoods, we see breeding opportunities, and so if we go with the 4 Ds, We drain the standing water. We dress appropriately. We make sure that we're monitoring ourselves and our surroundings and supporting our residents in terms of code enforcement is going to be a key component. And so if you're practicing that activities, then you would reduce the amount of spraying that has to be done.
Yeah, and at the end of the day, that's what we all are
Right.
looking for. Is there anything anyone else would like to add?
One of the things I want to mention too is that spraying is just one part of the program.
Yes.
A lot of people think that, oh, I'm calling in, I've got mosquitoes that are biting me, let's get the county out to spray. And that's not how we do things. We're spraying for specific vectors who are carrying disease. We don't spray for nuisance mosquitoes. So there are other parts to that. One of the things that the county has worked with us on is providing us with some mosquito dunks. They're
Yes.
non-toxic, non-hazardous items that we can issue to residents, and we have those at the Action Center. So if people would like to get some of those, they're just they're a bacteria that once it's activated with water, they coat the surface and help reduce the larvae before they hatch into mosquitoes. So it's just another thing that we can do to help, and those are free of charge at the Action Center.
Very good information. Jimmy, who should people call if they have questions or if they would like to get some of those mosquito dunks?
There's some good resources for public information. First, we'd like for them to call the Action Center in the City Hall, and we have the number on the bottom of the screen, and any resident who would like information can call there, and then we can refer them to the county's website, which is a wealth of information on specific diseases, and it's updated very regularly. So call the Action Center, we'll hook you up.
Very good. And I'd like to add too that for our DeSoto residents, we have a special Notify Me on our website.
Mhm.
Anytime spraying's taking place, if they'd like to be notified so that they can make sure their pets are in or whatever. Obviously, everyone needs to know, but if they have special needs, that's the quickest way to get a message. And to go to our City of DeSoto website and sign up for Notify Me, and it's the mosquito spraying detail. Well, thank you so much for being here. I think we've done very well today. We've provided some good information for people out in our community. I'd like to again thank Director Thompson of Dallas County. Thanks for being here. And Dr. Perkins, and of course Jimmy Stevens, our environmental health specialist. And I'd also like to thank our viewers for tuning in to another edition of Focus on DeSoto today.